Our main focus in the coming years was admissions. We wanted to increase the amount of students in these spaces because there's a pipeline.
The Black Medical Students Association of Canada is in Montreal for their annual general meeting, a conference for and by Black Canadian medical students. The goal, to strategize around important issues in education and Black health with sessions attended by students from all 17 medical schools across Canada.
When I was a resident, when I was a medical student, we didn't have an association. It was just me. I think we were something like 3 students in a class of over 200 students.
There was this sense of an unprecedented awakening in a lot of students, just with everything going on across the world, and they got together, albeit very small group. We started off our membership with maybe 50 students, and now we're ranging around 300 students of all across Canada over 5 years.
The representation at the AGM from across Canada allows students to share their unique experiences.
The landscape for Black medical learners is very different depending on where you are. So for example, at the University of Toronto, they have a lot of Black students, so they have a large community there. They have their own struggles and challenges, but those are very different than the struggles and challenges and experiences that the Black medical students in Manitoba face. That's different from what folks in Calgary face, different from folks at BC face.
As this year's conference keynote speaker, Dr. Bastiani says the positive effect of diversity among medical students is clear.
They learn how to better care for patients from minority. They learn how to care in a culturally safe manner too. It's super important for students who are not from the minority as well, because they learn how to care properly for patients from the minority.
One of the things that I really admire about each and every Black student that's here today is how committed they are to really transforming the environment they're in.
We need to have that representation for our patients and for ourselves, for our family, to show little children who want to be what they want to be, that they can be that.
I had the opportunity this year to work with some amazing organizations that believe in us. And I think that's something that we as Black medical students have initially struggled with. Who believes that we're going to be great physicians and that we're going to support Canada's healthcare system?
Black faces in all the spaces is what we like to say.
In Montreal, Anastasia Dextrene, City News.